Reflex testing assesses the integrity of the nervous system by looking at the response to different stimuli. Reflex testing can assess the upper motor neuron or central nervous system or the lower motor neuron, peripheral nervous system. If there's an issue with the neural pathway between the spinal cord and the muscle, the therapist will get an altered response when testing the reflex. It is important to note that there can be significant variation between patients with reflexes, and many things can influence the reflex response, including stress and anxiety. As we age, our reflexes often diminish, and therefore in older patients, it's not uncommon for reflexes to be absent or significantly reduced. When evaluating reflexes, it's therefore important they are always compared to the other side and interpreted in the context of the patient's history and other testing. Lower motor neuron testing often involves testing the stretch reflex, where the tendon of a muscle is tapped with a reflex hammer to elicit a sudden stretch in the muscle spindle receptors of the muscle, causing a reflexive contraction of the muscle. If there's a reduced reflex, this is called hyperreflexia and could be the result of neural compression on the peripheral nerve or nerve root. If there's an exaggerated response, hyperreflexia, then this is often due to reduced descending inhibition from the cerebral cortex, and often indicative of a central nervous system pathology. Specific upper motor neuron tests include the Babinski sign, Clonus, Romberg sign, or Hoffman's testing. Check out our Neurological assessment channel for how to assess reflexes clinically.